Ketorolac is a nonsteroidal anti-inflammatory drug NSAID with analgesic pain-relieving and anti-inflammatory properties. Its pharmacology involves several key aspects. 1. Mechanism of action. Ketorolac works by inhibiting the enzyme cyclooxygenase COX, specifically COX1 and COX2. This inhibition reduces the production of prostaglandins, which are chemicals in the body that promote pain, inflammation, and fever. 2. Indications. Ketorolac is primarily used for the short-term management of moderate to severe pain. It can be administered orally, intramuscularly, or intravenously. 3. Duration of action. It has a relatively short duration of action, typically providing pain relief for up to 6 hours. 4. Dosage forms. Ketorolac is available in various dosage forms, including tablets, injectable solutions, and eye drops. The ophthalmic eye formulation is used to manage inflammation and pain following eye surgery. Oral tablets for pain management. The usual adult dose is 10 milligrams every 4 to 6 hours is needed for pain. The maximum daily dose for oral Ketorolac in adults is typically 40 milligrams. Intramuscular injection for pain management. The usual adult dose is 30 to 60 milligrams as a single injection, not to exceed 60 milligrams in a 24-hour period. In some cases, a lower initial dose of 15 to 30 milligrams may be used. Intravenous injection for pain management or as part of postoperative pain management. The usual adult dose is 15 to 30 milligrams as a single injection. This dose may be repeated every 6 hours as needed, but it should not exceed 60 milligrams in a 24-hour period. Ketorolac, like other nonsteroidal anti-inflammatory drugs NSAIDs, can have several common side effects. These side effects can vary in intensity and may not affect everyone, but it's important to be aware of them. Common side effects of Ketorolac may include 1. Gastrointestinal issues, upset stomach, nausea, vomiting, diarrhea, indigestion, abdominal pain or discomfort. 2. Dizziness and headache. Some individuals may experience dizziness or headache while taking Ketorolac. 3. Injection site reactions for intramuscular or intravenous forms, pain or discomfort at the injection site. 4. Renal effects. Ketorolac can affect kidney function, potentially leading to changes in urine output and kidney function. If you notice a decrease in urine output, swelling in the ankles or feet, or any signs of kidney problems, it's important to seek medical attention. 5. Hypersensitivity reactions. Some individuals may be allergic to Ketorolac, and in rare cases, this can lead to allergic reactions with symptoms such as skin rash, itching, swelling, or difficulty breathing. Seek immediate medical attention if you experience these symptoms. 6. Gastrointestinal bleeding and ulcers. Although less common, NSAIDs like Ketorolac can increase the risk of gastrointestinal bleeding and the development of stomach ulcers. This risk is higher with long-term or high-dose use. 7. Cardiovascular effects. NSAIDs, including Ketorolac, have been associated with an increased risk of cardiovascular events, such as heart attack or stroke, especially when used at high doses or for long durations. Ketorolac can interact with other medications, potentially leading to adverse effects or reduced effectiveness of one or more drugs. Some of the most common drug interactions associated with Ketorolac include 1. Other NSAIDs. Concurrent use of multiple NSAIDs, nonsteroidal anti-inflammatory drugs, including Ketorolac, can increase the risk of gastrointestinal bleeding and ulcer formation. Combining Ketorolac with other NSAIDs should generally be avoided. 2. Anticoagulants and antiplatelet drugs. Ketorolac can increase the risk of bleeding when used with anticoagulant medications like warfarin or antiplatelet drugs like aspirin. This combination should be used cautiously and monitored closely by a healthcare provider. 3. Corticosteroids. Concurrent use of corticosteroids and Ketorolac can increase the risk of gastrointestinal bleeding and ulceration. This combination should be avoided or used under strict medical supervision. 4. Selective serotonin reuptake inhibitors SSRIs and serotonin norepinephrine reuptake inhibitors SNRIs. Combining Ketorolac with these antidepressant medications can increase the risk of bleeding, particularly in the gastrointestinal tract. Caution is advised when using them together. 5. Diuretics. Diuretics can reduce kidney function, and when combined with Ketorolac, which also affects the kidneys, there may be an increased risk of kidney problems. Monitoring of kidney function is important in such cases. 6. Angiotensin-converting enzyme ACE inhibitors and angiotensin receptor blockers ARBs. The use of Ketorolac with ACE inhibitors or ARBs can lead to reduced kidney function and an increased risk of kidney problems. Close monitoring is recommended. 7. Methotrexate. Ketorolac can increase the blood levels of methotrexate, which can be toxic. If these drugs are used together, close monitoring and dose adjustments may be necessary. 8. Lithium. Ketorolac can increase lithium levels in the blood, potentially leading to lithium toxicity. This combination should be used cautiously, and lithium levels should be monitored. 9. Cyclosporine. Ketorolac may increase the risk of kidney damage when used with cyclosporine, an immunosuppressant drug. Careful monitoring of kidney function is essential. 10. Antihypertensive medications. Ketorolac can reduce the effectiveness of antihypertensive medications, potentially leading to increased blood pressure. Blood pressure should be monitored when these drugs are used together.